Hey everyone, thank you for joining today. We are going to have Roshan presenting on the ACO Reach model. She is currently the Executive Director of Pharmacy here at Belay. So Roshan, I will go ahead and turn it over to you.
Thank you, Alexis. Welcome, everyone, and thank you for joining me today for ACO Reach model description. As Alexis said, I'll be talking about ACO Reach. When I say getting on the bandwagon of social determinants of health, ACO Reach model is the best way to the approach. CMS has expanded its strategy to advance health equity and to ensure sustainable and meaningful approach to patient care. ACO Reach provides novel tools and resources for healthcare providers to increase and improve the quality of care for traditional Medicare beneficiaries. By strengthening their voice and by focusing on quality of care for underserved population using value-based payment. Next slide, please. To advance health equity, we focused on 4 domains of social determinants of health that was relevant to our patient population. Those 4 domains are health literacy, transportation insecurity, medication affordability, and food insecurity. We also focused on 3 quality measures. By focusing on timely follow-up through a robust care management and care coordination program, proactively managing our high-risk population to avoid unplanned admissions and readmissions. With practice transformation focus for primary care practices, we did evaluation of providers following best practice evidence-based guidelines, define provider payments based on agreed contracts, and manage and monitor different chronic conditions by focusing on patients' social, clinical, and behavioral health needs. Next slide, please. And why I say ACO Reach program. This program is heavily focused on primary care and health equity for patient outcomes. The program benefits for primary care physician is upfront payment, health equity benchmark adjustments for underserved population, payment for infrastructure to improve the quality of patient care by care management, and potential to do more for your patients without incurring additional cost. For Belay, it has been our pleasure to see our practices succeed. I've been humbled with the lessons that I've learned in the first year of program, and we have increased health outcomes by helping our practices succeed by focusing on the right patients at the right time. We improve chronic condition management of their population, and by aggregating our data, we collected all the data, aggregated it, we did quality checks, and then we disaggregated to understand the disparities in our population so that we can provide them with stratified care management approach and interventions they need. With the multidisciplinary approach here on Belay, we provide support for our physicians and for our patients to succeed in the model. We identify care gaps and provide support for our practices so they can succeed in the model. And thank you for joining me today for the webinar. If you have any questions about ACO Reach programs with Belay, please reach out to us at the below link. And Alexis, thank you so much for having me today.
Thank you so much, Roshan, and thank you everyone for joining. As she said, there's going to be a link sent out tomorrow for feedback and questions, as well as a survey as the webinar concludes, where you can also submit feedback and questions. So I hope you all have a great rest of your day, and we'll see you next time. Thank you.
Thank you.